My name's Sarah Green. I'm a physician assistant and been working a lot with cancer patients. And I am excited to hear what you're doing with cancer patients and the outcomes that you're getting, because I think that it's important for people to understand that there's alternatives than just chemo and radiation. So take it away.
Yeah, thank you so much for having me. It's a pleasure. Yeah, it's Dr. Yahya Annan. I'm a PhD doctor in biomedical engineering, and I slightly found myself a cancer researcher and metabolic, dysfunction metabolic therapy, cancer support expert, and have been dealing mostly only with cancer for a while. So I'm a big believer in alternative medicine, alternative therapies, mostly natural, and also using some effective drugs, for example, safe drugs like Ivermectin and Fenbendazole and other things. And yeah, I'm trying to help as much people as I can. I want to spread the message. I want people, to hear about this alternative so they can make more informed decision.
Yeah. Do you feel like when someone comes into my office, their first appointment, they'll often come in with lots of family members and they're crying in the waiting room and a big hug, and they finally feel, no matter what the outcome is, right? Because nothing's guaranteed, is they have hope for the first time since their diagnosis. And I hate even saying the word because then people identify with it, but there's hope where the other alternatives, it's doom and gloom. And so I know a lot of your stuff has stress reduction and trying to kind of, because stress literally will kill you. Just giving patients hope that there's something else out there that can work for them, that may work for them. What do you see in that? Just changing the perspective.
Exactly, you're very correct. So usually they come to me also with the mentality or point of view of conventional treatment. They ask me what is my prognosis. So what do what is my success rate? And I always say I don't use these terms. These are their terms. So ignore all what they say, ignore all these classification stages, mutations, all this stuff you have to ignore. We are here basically to try to heal you. We try to target the root cause. We try to find what's causing this. And we try to understand cancer, how it grows. And we try to basically come after it with, what God's give us. So this is the thing. And then, as I said, always, especially for unfortunately, most people who come to me, they are stage 4 and they already exhausted the conventional treatment, about maybe 80%. So that's the thing. And I say in the conventional treatment for stage 4 especially, it's a palliative care. So there's no cure. There's zero cure, right? It's a downhill, and then success is like less than 5%. What I say in my side, there is hope, there is positive chance for cure. Even if it's 5-10%, but still there is hope. We have a lot of people who able to turn it around. They have been sent to hospice, and then they cured and they still living. We have all these stories. So there is hope, positive, zero, right? On the other side, they suffer, there is killing you slowly, and there is also zero cure. So that's the thing. So, and then I try to, because I'm in the education business, not the prescription business. I don't prescribe things, and I'm trying to make them understand. Part of it, most of them, they watch the videos, they read everything, so they already pre-educated, I would say. And then I try to paint the full picture. I don't even say don't do this conventional treatment, do my protocol or push. I said, this is the full picture. This is what you get in here. And most of them, I ask, like, you already get the taste of it. So when is enough is enough? It's like, and some of them, unfortunately, they are very scared. They are pushed, they are bullied, they are, it's very hard for them. And some of them, it's like, yeah, no, I think I'm done with that one. I want to try the alternative things. And that's, so I'm trying, because if we also, yes, I talk, I just try to tell the truth about conventional treatment, how it doesn't work, but at the same time, I don't want to censor it and then push only my idea, then I will be the same, right? Because they try to cancel the alternative.
Sure.
And they try to put only their for me, it's like I want people to have both options. This is the reality of both options, and you choose. So that's my point of view.
Yeah. And I do the same. They'll come in, and a lot of it is stage 4. They've done the chemo. I actually have a few that are currently in remission. They came to me stage 4, colorectal cancer, and mets to the liver was one of my patients. And, his oncologist was, he kind of picked her brain a little bit about ivermectin and mebendazole. And she was like, absolutely no. And he said, well, what's your success rate? That kind of thing. But like, what am I looking at? And she said, if you don't do chemo, you're looking at a year. And if you do chemo, you've got 2 years. And he had no symptoms. I mean, he was active, he was healthy, he was living life. And he said, so regardless, I die in 2 years. That's what you're telling me. So I could either be sick for 2 years because that's what chemo is going to do to me, or I can feel like this, and you're telling me a year. And that's when he came to me, and I said, first of all, I don't know why any oncologist thinks that they can give you a timeline, right? Because God's the only one that can heal you. And so for some doctor to say that this is what you have left is I think what a horrible thing to say or to do. And he didn't do any of the chemo. He went on a bunch of different supplements, meds, changed his lifestyle. High dose IV vitamin C was in my office pretty regularly getting that. And he's been in remission now, I think, for 3 months. And he's doing great. And so you look at, and he really went gung ho. I mean, he took all of Makis's, all of Palmeric's, I mean, he really did everything, even more so than what I was having him do, because he was just like, I'm going to do it all. And he's doing phenomenal. He's actually in Hawaii right now, traveling and having fun. So he's doing great, where the outcome was so sad. And I do have some that are doing the chemo and some are doing the radiation, because I don't want them to come to me and say, I wish I had done something else.
Exactly.
Right. The outcome isn't what I wanted, because there's nothing guaranteed in life.
Yeah.
So I don't want any regrets. I want them to do whatever. I won't steer away like you. I won't steer away from anything. I'll support whatever they want, knowing that what they're doing is, it's just destroying the immune system, where we really have to build it up. That's the goal.
Exactly.
So,
And sometimes it's too late. You cannot even recover. So from this treatment. So yeah, that's
true.
I mean, there's a point actually. I mean, to be honest, just there's a point where they are too damaged. But again, there's always hope. I put a chart usually, let's say, about the success rate. People ask about the success rate, and then basically the chart starts on top with high success when you got diagnosed. So first time you got a lump, you get some symptoms, and then you got diagnosed, and then you immediately change your lifestyle, immediately start implementing, and then success is very, very high. And then you go downhill to, you start by biopsy, all the scans, all the chemo, radiation, surgery, then temporary remission, then okay, now recurrence, 80% chance of recurrence, then okay, more aggressive chemo, radiation, and then you exhausted your options, and then your platelets are low, you're anemic, we cannot go do no more, and then they send them home, and they dare when they come to us, send to me or something like that. So and then, as I said, but that time usually bone marrow suppression, immune system is down, inflammation is very high, and then it's like it's not about the protocol anymore, but how healthy the body is. But again, at even that point, some people miraculously can turn everything around. So that's the thing. But we try also, I want to educate people, especially do conventional treatment, but at least, learn blood tests, learn how to read the blood test, learn how to see the symptoms. So, because most of them, they come to me, they don't know even, they do the blood test, but they don't know anything what's there. Because, you see, usually patients come to you and they test them before each chemo, right? And they see, okay, can they take more? Okay, platelets is 50. Okay, he's not gonna die yet, so we're gonna give him one more. Right. But then 23, okay, now it's like we got stopped. So you get the. But if a patient, I think, understand a bit, okay, my platelets going down, okay, I'm a bit anemic, red blood cells, white blood cells, lymphocytes are below 1, that means I don't have immune system. Okay, maybe I stop, right? Maybe, take a break or something like that. But unfortunately, we have this unearned and conditional trust in the medical system.
Right. Right.
So that's the thing. So I think because people, and I'm not sure about you, because you're a medical doctor, right? So you get this credibility. But if they come to alternative, they are very skeptical, and they come with all these questions, and they do research, and then all of this, but they don't do the same with the medical system, because like you go there and then you surrender, tell me what to do.
Yeah. Yeah.
And I'm trying to change this. So, but hopefully, there's some hope. I'm starting getting people, stage 1, they got diagnosed, and then they start taking action. And this is, I'm, like that's where I'm very, very happy. Like, we can fix it like that, easy, like 100%. That, but I mean, and then, the more damage, the more difficult it becomes.
Right. Right. Well, and ideally the goal is prevention, right? Which there's not, I mean, there's no preventative stuff. And I mean, at least in America, like it just, you feel like everything is, our food is poisonous,
Yeah.
our water is poisonous, the air is poison. I mean, everything is poisonous. And so trying to get someone before it even happens, because the metabolic dysfunction starts happening pretty quickly.
Yes.
Are you seeing, because I actually was surprised at how many of my cancer patients aren't vaccinated against the COVID-19 vaccine. What are you kind of seeing in your population? Are you seeing it a percentage higher that are or that aren't? Or what do you
Yeah,
see?
definitely. Most of them, they are vaccinated. So, I put a form. I make them fill a form, and they have all the data. And at a certain point, I will publish basically the data once I get a large cohort. And
Mhm.
yes, a lot of them are vaccinated. A lot of them, they got diagnosed after. I don't have the exact number, but yes, they got diagnosed. They got diagnosed with cancer after they don't take the COVID, and
Mhm.
which interesting to a lot of them, they got reoccurrence after they get the COVID vaccine.
Yeah.
And of course, I mean, maybe a lot of them also, I mean, they didn't get the COVID vaccine, but still, they still have cancer. So it's not 100%, but there are percentages, I would say. Yeah.
Sure. Sure. And it's funny because I have a handful too that got the Johnson and Johnson, where they all kind of thought that that was the better of the three
Yeah.
that were at least available in the US. I don't think AstraZeneca ever came to the US. But a handful, a big percentage that are Johnson and Johnson, at least that I'm seeing. And so I think that there was this, I mean, we know that they lied to us about, well, they lied
Of
to us
course.
about everything, but the Johnson and Johnson, I think, is just as dangerous or causes just as much dysfunction in the body as the Moderna and the Pfizer, at least in my practice, is what I'm saying. Do you have a lot of Johnson and Johnsons, or is it pretty even?
I honestly, I don't ask about. I just ask about,
Okay.
you took the COVID vaccine, yes, no, and that's it. So I didn't ask about particular. But is Johnson is the same mRNA technology or a different one?
No, well,
The traditional way?
yeah, the thought process, at least what they fed to the people, was that it was not the mRNA, and it was it was supposed to be a one and done, right? So most people
Okay.
were like one and done and not the mRNA.
Okay.
But I some went and got boosters, and it wasn't a Johnson Johnson booster. But even the ones that took the Johnson one and done, I've tested those antibodies with the spike protein, and they're like through the roof. And so if it's not an
Yeah.
mRNA, then why are their spike antibodies so high? They're obviously making spikes. So somehow it's turned on the machinery. I don't know. Um,
Exactly. Yeah. Yeah. I mean, maybe different mRNA, but I mean, the mechanism is the same. As you said, like producing spike proteins, which are what's the term? Undetoxable. So they don't get detoxed naturally, or then they go away. They stay there, and you have to do basically, what's called. So you have to detox them in a certain way to get rid of them. So I think Dr. McCullough put a protocol. But what's
sure.
interesting too, because it's just a thought, but also people who got, because I asked this Dr. McCullough, because he's the one more educated in this one. I told him people who got the COVID but not the vaccine, they can still have the same symptoms, same effects.
Right.
So that's what. So I was interviewing him, talking to him, and then so and I was asking, and then is people who got the COVID vaccine, maybe some people they got it but they didn't realize, or like maybe it was like a normal flu, or
Mhm.
can have the same effects and as people who took the COVID vaccine? And his answer is yes. And
Mhm.
when he said that, I was like, I think I went away. Even I was in my mind went away because I lost my father last year. So,
Mm.
and then it was an unexplained situation.
Mhm.
So, and then of course, after now I've analyzed everything, it looks like blood clotting
Wow.
because he basically lose his conscious and fall, and it wasn't explained. But because my father didn't took the COVID vaccine, so and this complication happened after the COVID. And I was trying to like what was wrong, and even I ran at that time I was not very educated, like blood clotting, D dimer stuff. So we did a blood test and everything looks okay. Even the inflammation was not high. So when he was talking, it's like an asking, and then like I like it's like I had what's called the film that comes, and I would start to connect the dots. And
Yeah.
and then I believe also people who got, because it's engineered virus, it has the same goal. So that's the thing.
Sure.
It is like a
Sure.
bioweapon. And then I start
Mhm.
connecting things, and then even people who got the COVID can still have the same side effects as people who got the vaccine.
Yeah. Yeah, and I have a few patients who ended up getting cancer very rapidly. They did not take the vaccine, but they were around a ton of people who had taken the vaccine. They worked in an office where they were the only one that didn't take it, and so they were surrounded by shedding, and we know that that's a problem. And then you're right, like I'm testing antibodies the same way I'm testing them for someone who was vaccinated to people who are not vaccinated, and their antibodies are still just as high as those who were vaccinated.
Correct.
And so
Correct.
I don't know. I mean, I don't know if, and Dr. McCullough would probably know this. Sure, you're making those antibodies super high. Is it just as dangerous? And it sounds like it is. And the mechanisms of what people succumb to, the blood clotting, the heart attacks, the atrial fibrillation, the cancers, neurological stuff. I mean, I have some that got, ALS shortly after their vaccine and succumbed to that pretty quickly. And they were super healthy before. And so,
Yeah.
they don't want you to link it, but and the world, I'm going to pick your brain a little bit in the world of chlorine dioxide if you're okay with
Yeah.
that.
Sure.
um because I'm using ivermectin, and I know a lot of people use the fenbendazole. It's super easy to get your hands on. I use mebendazole and have some compounding pharmacies that can get it pretty stinking cheap, and I mean commercially it's very
Yeah.
expensive, almost so expensive that they don't want you to have it. I haven't really implemented the fenbendazole, although I think that they're probably pretty similar in their mechanism of
Mhm.
action. Whether one is better than the other, I don't know. But I haven't done, and it's supplements, stress reduction, sunshine, exercise, sleep, grounding, prayer work, meditation, whatever, and a bunch of supplements. But I haven't really done the chlorine dioxide. I have had some patients that on their own are, they're like, do you mind if I do that? And whatever, I don't mind. Um,
Mhm.
are you seeing that adding that to the protocol is beneficial, or is it too early to really see?
Yeah, actually it's very. I can see the positive change once I started using it. So the reason I came across, because I always look for the most powerful things against cancer, and I want to see studies. I want to see case reports. I want to see documented case reports, not only testimonials or videos of people saying they'd use something. And I came across this case study, which is amazing. I think the guy from Chile, I think, or another country. And then
Uh-huh.
there's, documented cases, imaging before and after, and then the whole protocol there. And yeah, and then of course I did a lot of research. There's a lot of actually like documentaries talking about it, but I think the medical system went hard on it, so they managed to suppress it. It's called like the universal antidote. So if you write in Google universal antidote, you get a lot of. So people are using it for everything, not only cancer. So use it for almost everything. So like there's not, if you see, as I said, well, one of cases, even diabetes, any case they use chlorine dioxide.
Okay.
So yeah, that's why I said, it's a confirmation. All my boxes are ticked. I need to include this in the protocol. And just just, I mean, talk about the protocol a bit because it will make sense why we are using things, because my protocol is based on targeted metabolic therapy. So basically, you understand the cancer, you understand the growth mechanisms, you understand the microenvironment, you understand, the triggers, signaling pathways. So the metabolic dysfunctions that can trigger or help. And then once you understand everything, you have I would say you understand in how to target it properly. So I'm gonna hopefully in the next maybe couple of months, I'm gonna publish scientific paper about this targeted metabolic therapy. So, and just in summary, let's say you have prediabetes, for example. Usually it's linked to the cancer. You have low vitamin D, you have hypothyroidism, you have hypertension, inflammation. So different metabolic dysfunctions. And when you target cancer, you have to target these and fix these. So that simultaneously. So that's why the protocol, each supplement or meant to target, one of, let's say, growth mechanisms or dysfunctions. So that's the part of the metabolic dysfunction. At the same time, if you understand cancer, how it grows and how it uses, for example, glycolysis, which is using glucose to fermentation, and then by that, if you understand how it works and then how it produces lactic acid, for example, makes the microenvironment more acidic. Okay, so if I target this glycolysis and block glucose from the cancer, and then that's a great strategy, right? That's why we use ketogenic diet, and then we use fasting, and we use berberine, and even potentially metformin if we want to. And then we have, for example, apoptosis. So, normal cells, basically, when they reach an age, they just die automatically, and then, or when they become dysfunctional, they die automatically. But cancer cells, they don't. They skip this apoptosis. So they're still alive, even they are dysfunction. And then you have, for example, ivermectin. One of the mechanisms, they induce apoptosis. And of black seed oil, curcumin, they all do the same. And then you have angiogenesis, which build in, for example, blood vessels to feed the cancer. So that's one of the, and then of course, there's different drug and supplement who targets that one. You reduce inflammation in the microenvironment, black seed oil, curcumin, full spectrum CBD oil. So each, for example, you understand cancer, how it grows, and then basically you cut all, the growth mechanisms, you fix the body, and you have the best plan ever that was built for cancer. And then we come back to the chlorine dioxide. Why is there? Because basically it's maybe one of few, you can reach the goal with multiple, maybe similar things, but it uses oxidative stress, is oxidative agent. Basically, it's to simplify it, it's gas in water. So, and it used to be used to purify water, and then it's used to kill viruses, fungus, parasites too. And how it does in cancer, basically, it oxidates, selective oxidation. So basically, it increases oxidation in the tumor microenvironment. And then because the cancer cells are more vulnerable, so they die very fast. While so healthy cells can protect themselves. So they are not harmed by this oxidation. And also, as he said, it kills funguses, it kills parasites in the same time. And indirectly, it lowers inflammation, it lowers acidity, and also modulates the immune system. So this is what the data tell me. So, and this is like, as I say, when you put a puzzle, like a protocol, and there's something was missing, and then I put chlorine dioxide, I think it was, now it's like more complete. Right. Yeah, and then the side effects are very negligible, just detoxin side effects. Right. But usually it's very tolerable, safe, and yeah, that's chlorine dioxide. And there's a lot, as I said, there's a big case report study. I think there's 7 studies, people who are, full remission or partial remission with chlorine dioxide.
Okay.
So people can read about it.
Yeah, I've been studying it for probably 4 or 5 years now. Haven't really implemented it, but have had patients that have gone out. I talked to Pierre Corey about it a little bit, and he's like, yeah, I mean, we're having people do it and we're seeing good results. It's another tool in the toolbox to help patients out. And And you talked about the modified citrus pectin, and that's just pulling out all kinds of stuff too, and has some anti-cancer properties. It's
It block metastasis too. That's why I use it, because it block metastasis. And
yeah,
also it's partially binds to toxins. That's what I like it too. But
yep,
I use it for the purpose of blocking metastasis.
yeah. Okay. Is your dose 15? I know a lot of people it's 15 grams a day. Is that kind of what you're
I use 6 to 10.
6 to 10? Okay.
Yeah, I use 6 to 10.
Okay.
So
I
that's
know
that's
these
the
complaints on the supplements, like, oh, that stuff I have to fit it where I'm not taking anything and an empty stomach, but
yes, it's very hard. The only challenge is managing all of this, because some of them are on empty stomach, some of them like 1 hour before food, 1 hour after food, and then between meals and before bed, and then people like I tell them like this is a full-time job. That's
it really
so
is.
it is a
It is.
full-time job.
Yep. And usually family, if I get some, like I have several that are on hospice right now. I mean,
Yeah,
they're palliative care hospice. And unfortunately now they're coming to me. And we'll see what we can do. I do have some though that I truly believe in family. They've eventually have succumbed to their illness, but the family all believe, and I do too, that the protocol that they were on definitely extended their lifespan. And it
sure,
not just extended the lifespan in a good way, because who cares how long you live if you're absolutely miserable, right? So quality
exactly.
quantity is so important. But they were good. They were still doing the things they enjoyed doing. They weren't sick. They weren't in bed. They weren't fighting off infections. They weren't, cachectic or super skinny. I mean, they were flourishing. And so, regardless of the outcome, although we're getting a lot in remission too, the extension of the lifespan, because you know, the
Quality
guarantee
of life,
typically
quality of
does,
life. That's the
right?
thing.
Yeah.
Yeah,
So I
quality of
think
life matters.
it does, and their outlook. I mean, it's so sad, and it blows my mind. I have not had a single patient who's come in who's seen their oncologist who has said, "Wow, my oncologist agrees with like your diet is important." It's quite the opposite.
Yeah,
Every single patient of mine that has seen an oncologist has said, "Well, the oncologist says it doesn't matter what I eat. They want me to eat whatever I want." In those chemo infusion rooms, you've got the donuts and the cookies and the punch and the sodas, and you're like, "Oh my gosh, you guys are sitting there in a chemo chair getting an infusion while you're eating high fructose corn syrup, processed foods, and you're just flooding your body with toxins while you've got this drug infusing in your arm." I mean, it blows my mind. I haven't had one oncologist agree that your diet is important before, during, and after treatment. It's
yeah, because
crazy.
like I used to, I'm not sure how far can go in this interview, because I used to, look up to them, and then, but after realizing, I mean, hundreds of patients, not thousands, like they are very stupid. They're very, very
Yeah,
stupid. They are.
yeah,
I mean, you are different, right? You do your own research. You are very smart, but most people or doctors, they just memorizing books, right? They don't, solve things. I did like bachelor, masters, and PhD. I spend my life solving problems, equations, coming up with new things and solutions, and
sure.
so this is how I got my PhD. I had to create something new, some solution to basically glycemic control for intensive care patients. So you have to find the model. So like it's like this critical thinking, like and always research and always involving. I think that should be what the medical system. But most of them, they have a book, mostly written by big pharma, and they have to memorize it and then have to give it back in the exams, and then how you become a doctor. And no
Right.
wonder, I mean, anything that outside that book, they reject it. So it's not what they believe in. And
Yeah.
then even when if you have a conversation or like you try to make sense, some of them they get angry or like aggressive or something like that. Because I
They've
mean,
got
I say this like it's. I mean, try to have a conversation, because, like you said, yeah, you have chemo and then they give you all the sugary stuff, and they said, like when you do a PET scan for me, right? So what you are injecting in PET scan, and then like they will tell it's like it's radioactive glucose. So glucose, when you inject it, go to the tumors, and then the tumors start sucking it, and then it lights up. Like that means cancer loves glucose.
right.
And then why you make me eat glucose? So it's like you want me to grow the tumor or what? Like it's a
Right.
basic sixth grade, like conversation, but for some reason it's on the top of their head. So they don't want to discuss it. I don't know why, but
It's crazy. And we have some hospitals really kind of alternative. One of them, I actually am flying out in the beginning of October to Scottsdale to go get a tour of Envita, which I have sent a few patients to that really specializes in Lyme disease and cancer. And one of my patients explained to me what they do there, and it's fascinating. So they do micro dosing of chemo. So they still do some chemo, but infusions of curcumin and infusions of different like high dose vitamin C. And they allowed her, they actually encouraged her to continue her ivermectin and her mebendazole. But they will give you insulin to drop your glucose to 40. And
okay,
then they will use multiple different low dose chemos. I think she said 3 or 4 at different times, microscopic, and they mix that chemo with glucose. So they've now made you hypoglycemic. And
okay,
then they infuse you with this low dose chemo and sugar, knowing that those cancer cells are going to eat that stuff up. It's micro.
interesting.
So
Yeah,
they're just
it's like a
constantly.
Trojan house, like a Trojan house. Yeah,
Yeah. I mean, they're
yeah,
faking the tumors out. They're tricking it. They're doing this, they're doing that to just make because the tumors are smart. They're going to
yeah.
find ways to feed. And so every time it was, you had to go in fasting, and then
Hmm.
they give you insulin to drop you. And I mean, obviously watch it closely, but it fascinating that, like, why are we not doing that? Why is it that you have to, typical insurance, well, they want you, we know, I mean, follow the money for sure. And this is all cash pay. I think some people are paying quite a bit, but regardless, the outcome is pretty awesome, and their technique and the philosophy behind it makes total sense. So
Yeah.
yeah, tumor cells love glucose, and the American diet is
And
it's
people do the same with baking soda. Actually, they mix baking soda with maple syrup or like, and then basically they drink it, and then they use it as a Trojan house. Basically, it goes to the tumor, and then it can alkalize the tumor microenvironment. So it's a good idea. I wish I have more data of it, but looks very promising. But for me, it's like, maybe we should not go this rabbit hole, but people say it's about the money, it's about money. I don't think it's about money. It's beyond that. It's way beyond that.
yeah.
Because tomorrow they can gather the best scientists, and tomorrow they can came up with a cure, and they can sell it for billions, and they can put people for lifetime subscription, and they can billions and billions, because people gonna get cured and people gonna pay for life, right? You can make more billions. But yeah, the motive is not money. So I'll leave it here. So let's let's go let's go next.
Pass that one. We'll pass that one. Yeah. Yeah. So, and you've been doing this. I mean, how long have you been kind of down this path of looking at alternatives? I think the rise of cancers, obviously after those COVID vaccines, my 85, 90% of my practice is now people fighting different cancerous cells.
Mhm.
Have you seen that, how long have you been doing this? And is this because so many people are sick that you're really focusing on this particular area?
Yeah, so I started, as I said, I'm a glycemic control researcher and scientist. So I used to glycemic control in intensive care patients. And
Yeah.
then I start to focus on diabetes, and basically I was always interested in curing. I don't like the medical terms. I want to heal people. I want to cure people. Especially diabetes is one of the easiest things to cure. But suddenly, no patients are interested in curing, because they rather continue eating what they eat, and they take the drugs, and they live, right. So yeah, so that's what I started. So I started with the diabetes, and then maybe general healing protocols. I was always interested in protocols, putting together
Mhm.
the best research, uh, components together to form well-targeted protocol to target that problem. And then I expanded also to the intestinal chronic diseases, IBS, IBD, GERD. I started building protocols. And then one time person came to me, I think a patient is like prostate cancer, and I asked me like, hey, do you have a protocol for cancer? And then I said, not now, but that's a good idea. I'm gonna put the best protocol for cancer. But my story with cancer started even with bachelor's, because I did image processing and artificial intelligence in mammography. So that's where I started to into cancer.
Okay.
And my master's is the same, is image processing in mammography.
Okay.
So I was familiar with cancer and then, tumor cancers and all of that. And then
Sure.
I have put together the protocol, and then basically you start doing it, and then the guy, fantastic results, like it's amazing, and PSA go down. And
Yeah.
but at the time, the censorship was very high. So I whenever I post the protocol, got demonetized, deleted, like it's just, removed. So I could never put any protocol before Trump got elected. That's like it's just
Wow.
demonetized immediately. So,
Yeah.
but the trigger, but I was always, doing all of this. But I think the trigger was when Mel Gibson did the interview with Joe Rogan, and then at that time also, Trump got elected, and Mark Zuckerberg came to the Joe Rogan podcast and talks about the censorship and how they were pushing everything. And then I think they released they know more, doing the censorship and everything. And then for the first time I could talk about, hey, I have this protocol. This is what Mel Gibson talking about. I've been using it for a while. And then I started getting attractions, and then I start, putting together the protocol. Here's the protocol, use it. And people start asking that question. I had to answer all the questions. And then, I was doing, at that time, I was still doing more diabetes and other stuff. But I found myself focusing more and more in cancer, because that's where people, struggling and come to me. And even, part of it, you have to follow the algorithm to a certain way, right? It's like, because if I talk about cancer, like diabetes, like people like, like, why you're talking about diabetes? Like, we are not interested, right? So that's I would say I had before cancer patients, but never, it's not at the same amount, the same intensity, the same. So I was pushed even to do deeper research. So I was reading all the studies, so going deeper, and then, I think the best data is when you actually have patients and you use different things and you gain experiences. And then, I think maybe, I don't know, 500 patient later, here I am. So I
Right.
have, super knowledge. I don't say know everything, but maybe most of the inputs, outputs, what happening, how to target it properly, understand cancer, in a very deep way. And what's final point is, I think what's more important and what's more difficult than coming up with protocol or applying a protocol is managing the protocol itself. So when you
Sure.
start taking all of the supplementation with the schedule and having side effects and things goes wrong, and then liver enzymes goes up, and then some tumor die-offs, and it looks like tumor progression, and then patients, like have constipation, digestive issues. He started feeling dizzy, and then, his body's trying to fight, right? He thinks he's dying. That's the most difficult part. That's the
Yeah.
most difficult part in the protocol. Protocol itself, it's the easiest one. It's not, it's available. There's plenty of protocols. But
Sure.
managing them, that's the most important thing.
Yeah. 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 And when I first started doing this, there's so many, not so many actually. I wish that there were more people doing it, but everyone has something different. And so when I would pick the brain of one person, I'd pick the brain of the other person, and their two protocols kind of clashed with each other. And I
Mm.
realized, like, it really is individualized protocols, and it's what a patient will tolerate. The dosage, I had one pharmacist talk to me the other day, talking about the dose of ivermectin, where to start. And he said, Sarah, just because you can rev a car up to the highest that it can rev up doesn't mean that you keep that car revved up in that
Mm.
forever or for a long period of time, right? So coming
Correct.
out the gate swinging, which I do sometimes, if my patient literally is on hospice, and to be on hospice at 6 months or less to live, I probably will come out of the gate swinging a little bit more than I would for someone who's in a stage 1 or stage 2.
Exactly.
But I also need to understand that, like, the body at that point is so depleted and malnourished and just completely, I mean, it's just going haywire, that if I'm going to throw something, pretty aggressive at them, are they going to tolerate it?
Correct.
So it really is kind of, you pick something and you kind of play around with it. And I'll tell everybody, I'm like, this is where we're starting. It doesn't mean this is where we're ending. So
Correct.
adjusting here or there, depending on, I think also this is probably something that I struggle with a little bit is when we've got somebody who's in remission now, weaning them off and getting them, I'm like, don't change your lifestyle, don't do any of that stuff. And they're terrified to get off. And we do go down, but finding ways to, I mean, I tell them like, maybe we just keep you on a 12 milligram dose of ivermectin, every
Yeah,
other day, or just to kind of keep that in your system, because obviously your body has the potential of making more tumor cells down the line,
correct.
especially if they had chemo or radiation where they've created an environment that another type of cancer cell can grow probably easier than someone who didn't. But I find my patients having a hard time getting off the meds when they're finally in remission. And I have a hard time getting them off because the last thing I want is for them to call me and say, guess what, I've got, whatever. So when you've got someone in remission, do you kind of keep them on a low dose of ivermectin? You use Fenbendazole too, but a low dose of those meds just to kind of keep things at bay, or is the goal really to just completely be off these meds and live a healthy life?
So my philosophy is I'm very, like sometimes I become very, I use tough love, right? I'm a tough love guy. I'm, like sometimes, especially with cancer patients, usually I tell them the minute you go back to your old life, you get cancer again, guarantee
Sure.
it. And
Yeah.
then at that time, maybe you won't have the same chance as this
Right.
time. So your blessing, just, be careful and then learn your lesson. That's one thing. But after the mission, my philosophy is like, I would keep the same protocol exactly with the same high dose for another 3 to 6 months,
Sure.
just to make sure to kill every, small cancer cell, stem cells, whatever, any trigger. But at the same time, like it's because did you check my protocol, right? Because most of
Yeah.
them is like, vitamins, minerals, curcumin. You can take this for life and then, nothing will happen, right? It will strengthen
Right.
your body. It's just the part with the repurposed medication or these semi-chemicals, I would call, that's the negotiable part that needs to be maybe reduced and cycled. But the natural supplements, I think there's no harm to keep taking it. So my philosophy is like, yeah, keep taking the same protocol for 3 to 6 months after, and then you just lower the dosage of most of the things, and then you cycle them. So
Sure.
ivermectin, as I said, maybe 12 milligrams for 2 3 weeks, and then you take 1 week off for like 20 days and 10 days off. But at that point, at that 12 milligrams, it actually don't get any side effects. So you get a lot of
Right.
anti-inflammatory, immune modulation, but you just, you get the, but at the same time, you keep any trigger, like down. That's the purpose.
Sure. Sure.
Yeah, and then I mean, also, if they are, some people are very also conscious, they are very knowledgeable, so become super healthy and they keep exercising, eat super clean, healthy, and then these people, they are likely to get recurrence too. So even they get off of the repurposed drugs, they already learned the lessons, they are super healthy, then they don't have to worry about recurrence.
Sure. Sure. And I mean, it's a lifestyle change, and
Exactly.
it's an effort, right? It's not easy to stay fit or go to the gym and wake up early, so you've got to have a drive, you have to have a purpose and a reason to live. And if you can keep that mentality, then you're not going to relapse most likely. But yeah, if you go back to, it's people that lose weight and then they put it back on, they yo-yo, and
Exactly.
it's just one of those, you can't, and I don't say a diet because I think people hear diet and then they are going to start
Yeah,
craving. It
that's
really isn't.
normal, that's how you should be eating, that's
Right.
normal.
Right.
So
Right.
that's the thing.
That's not, yeah, that's an everyday thing. And actually they feel much better when they change that. They get a little grumpy for a while and then, and then they feel,
Exactly.
they're like, this sucks,
I
but
mean,
actually,
the challenge is, so I'm not, maybe you have the same problem. Two challenges to the protocol. So most people are maybe in their, especially like late 60s, 70s, and it's very hard to change them, tell them exercise and like, change the diet. Even they do it, maybe they do it for a while, but it's hard to get them, because I mean, they start even at that time, maybe slowly giving up. They're not like, maybe like not very, very invested. The second thing, it's always, I think maybe the vast majority of the consultation. I don't have a percentage number. It's like a third party person. So the patient is not even involved. It's their daughters and sons who book the call, do the protocol for them, take them to the eldest, manage the diet and everything. So they are not involved. They don't understand what they are doing, and they don't even believe in it. It's like I'm taking all these pills. They told me it will help my cancer. And I don't think that's a bottleneck too. That's if when the patient is not involved, doesn't believe in this, does not fight for his life, that's a bottleneck in any alternative protocol.
Sure. You have to have drive. You have to have drive. Yeah. Well, I thank you so much. I'd love to do this again and pick your brain some more and share stories and share, the good, the bad, the ugly, but I'm seeing a huge decrease in tumor markers, tumor cells going away, growths going away, PSAs dropping to extremely low numbers. It doesn't cure everybody, but those that it cures, it's just amazing. So
Exactly.
thank you for taking the time, and I'd love to do this again and keep spreading.
Anytime. Just hit me up, and then I'll love to talk about this.
I appreciate it. Awesome. Thank you so much. Have a
All
wonderful
right.
day.
Have a good day. Bye-bye.
Bye.
Take care.